Let's react to this video by Go With Ali called I Got a Hair Transplant in Turkey, $6,000.
Alright, let's go ahead, head to the airport, and let's go ahead and fix my clapped hairline.
At this point, you're probably wondering why I am leaving Istanbul to go all the way to Ankara to get my hair transplant.
Reason number one is that with Istanbul being so popular with hair transplants, unfortunately it becomes very hard to go ahead and filter through all the noise to find a good clinic. Basically, some companies are operating like a hair mill.
I mean, a lot of times when I mention to people that I do hair transplant surgery, they are like, isn't that what people go to Turkey for? That's always an interesting start to the conversation. But yeah, of course, Turkey is a popular place for hair transplant surgery, but it's done in other places of the world too. And I think it's all about just finding the right, fit. You really should be selecting, I think, the specific surgeon and not just the clinic name, right? Because you want to know who's actually in charge of your procedure. There should be a doctor, a surgeon, someone who's very qualified, skilled at the helm to make sure that you get the right care and that things are designed properly, executed properly, that things are done safely, right? You cannot just pick a clinic and show up and get random people, doing your procedure. There needs to be a specific surgeon in charge, and when you're doing your research, you need to be picking that surgeon, not just some, named clinic, whether it's in Turkey or anywhere else in the world.
They will try to get as much volume through their doors as possible, and I guess the only way they could achieve that is by having the surgeon only do part of the procedure, and then after that they will get someone else who is much less qualified to go ahead and finish the rest of the procedure.
That's an interesting point he made. I think there is a range of, how involved the surgeon is. And there's, I think, an acceptable range. And then at some point it gets into the unacceptable. And you can debate that, right? I mean, some people want to make sure that their surgeon is involved for every single step throughout the entire day. Other people are okay if the surgeon steps away as long as there's a qualified, experienced team that's going to take over certain tasks, right? These are long days, right? These are full day surgeries. So it's never a one-man show. It's always a team effort. So whether or not your surgeon is the only one who's touching your scalp, there's still going to be helpers in the room, technicians, nurses, who are manipulating the grafts. They're working under the microscope. They're feeding grafts through, let's say, the implanter pen, right? They're passing the grafts over to the surgeon. They're still going to be involved in some fashion in the surgery. Acting like it's just, the surgeon that does everything is kind of a naive approach, because it's not the case in any clinic in the world that does this on a high level. But I think it's very reasonable and appropriate and necessary for patients to know what is the surgeon's involvement and who will the other people be in the room and what will they do and what will the surgeon do. And for every surgeon, it's good to be honest and upfront with patients, right? There are amazing surgeons that are there in the room every second of the day, and then there are amazing surgeons who step away for certain parts that they have delegated to trusted team members, right? So it gets very nuanced. Are the team of technicians or nurses or PAs, like, what's the composition of the team? And then is the team your full-time team, or is this like a traveling team that just comes in for a random procedure that you might have once in a while? Those are vastly different things. So those are the types of questions I think patients should ask. But sometimes the answer, you need to know what to do with that response, right? Just because your surgeon is involved with every little thing and is there in the room with you the whole time does not mean that your result is going to be that much better than another place where the surgeon might be at least somewhat less involved. So it gets complicated, but at the end of the day, you have to kind of go with your gut and do your research, talk to different clinics, talk to different surgeons before you make this important decision.
That is my first reason. Let me go ahead and check in and I'll tell you about my second reason. Reason number two is that most hair clinics will now use a method called FUE, where they take out a single hair graft from the back of your head and place it pretty much wherever you want it. So unfortunately, there's like a reverse incentive for them to say no to you as much as possible. They will accept all of your demands. You will end up with a crazy hairline that will come up to here and it wouldn't look natural. That way they can go ahead and maximize their profits.
Yeah, that's a great point. You know, nowadays with FUE surgery being the more popular route to take for harvesting hair, especially for, male hair transplant surgery, it's become that way that there is this perverse incentive for clinics to sometimes try to just maximize a number of grafts to charge the most possible, that they can squeeze out of a patient, especially with all the traveling that goes on for, hair transplants. People go to a clinic and the clinic doesn't know if they're ever going to return, or, there's really no long-term strategy. So they just do as much as humanly possible in a day or a 2-day session. And, there's a lot of downsides to that. I mean, overharvesting, not having enough donor supply for future procedures should you need it, especially when the hairline is brought down too low and too unnatural. So, I say no all the time. I say no to certain designs that patients request. I say no to patients who I feel like are not the most realistic. I say no when there isn't proper hair stability when we are planning surgery. Hair stability with medical therapy is so important. Most of my patients are on finasteride, minoxidil, and most of them these days are getting it through the Feel Confident website. It's a very convenient way where it's just delivered to your home, and there's no substitute for that. I mean, you want to protect the existing hair, and then we use surgery to build on a stable foundation. I mean, that's really key. I'll have some really exciting news to share about our Feel Confident hair care line very soon. So make sure, if you're not subscribed already, head to our feelconfident.com website, go to the newsletter, subscribe to it so you get the latest information, not just about our products, but also the latest information about hair care, hair transplants, and also all things aesthetic surgery related. Thanks so much for your support. But he's right. I think nowadays a lot of people are just trying to squeeze out as much as possible in a single session. And there's a lot of competition between clinics. I don't really think about that too much. I just try to do what's right for my patients. But, some people are competing on how many grafts can you harvest in a day? I can do 3,000. I can do 4. I can do 6,000. I can do, 6 from the scalp and 6 from the face, right? And then get 12,000 grafts in 2 days. It's just become like this arms race for how many grafts can we harvest. And it's, I don't think, the best approach. The goal is to really create a really nice aesthetic for the person, and one that's going to last and make sense for them throughout their life, right? And so you can't fully account for how things will change as people age and get, older and their hair thins out, and even on medical therapy sometimes. So we need to expect the unexpected and have some supply ready to go, and not just exhaust, full supply in one procedure, is my humble opinion.
And I guess after doing my research for almost a year and a half, the clinic that I am going to was one of the only clinics that actually said no to some of my crazy demands. I am literally the last person on the flight. I was prancing about getting a coffee.
Man, I'd be so anxious being the last one. I would hate for the plane to leave without me.
And reason number 3 is that Ankara is only 40 minutes away from Istanbul, and flights cost as little as $20.
That's like cheaper than a 5-minute Uber in New York City.
Tell me how I can help you, and what do you want?
So I guess obviously the main thing I want is like a natural hairline, and if it's possible to bring it a tiny bit down, that would be amazing. But obviously it's down to what you think looks best.
Yeah, so sometimes we can lower the central hairline, but oftentimes it's best to avoid that if it's already fairly low, and to just kind of work with what you got. There are times that for like facial framing, it does make sense to come down a little bit, but usually it's into areas where the person already had hair, just that as they got older, it has, receded. But for this guy, from at least my vantage point, his hairline doesn't appear centrally to be too high, so I would caution him potentially against any central lowering, because that will consume quite a number of grafts, and you just have to consider that he could have some additional recession over time, and we want to have enough grafts for any additional work down the road. But let's see what the planning looks like.
It's great if everything's good for the surgery. We can share our ideas and we can find the best for you.
Does it genuinely look healthy, or is it?
So I like to do at least a virtual consultation with my hair patients before they come in for surgery. And I'd like to have a good working plan in advance. So we use the pictures that they send to mark things out. Sometimes I'll print it out and mark it out for them. Sometimes they'll come into the office after the virtual just to confirm the plan. But I really don't want too many surprises on the day of surgery. So that's why I really think it's important to have a pretty good plan to begin with before the day of surgery. And then on the day of surgery, of course, we spend a lot of time doing the markings, really finalizing things. But I usually get all of the goals and a general idea of whether I'm lowering the hairline at all or not at all, whether we're doing some additional work in the crown, let's say, or what exactly the plan is. And that's actually in the financial agreement that the person signs up for, so that on the day of surgery we already kind of know what we're up to, which I think is a good thing for both patient and surgeon alike.
So first look, yes.
Okay.
I don't see any.
So he could be looking for density, appropriate density of hair. He could be looking for some skin conditions, like for example, seborrheic dermatitis or psoriasis on the scalp. These are inflammatory conditions that could make it more challenging for day of surgery, and for also potentially post-op healing might be more complicated, because every surgeon decides for him or herself at what point do they not feel comfortable proceeding with surgery. So that is probably some of what he was looking for there.
This shows the area, the density.
And it all looks pretty healthy?
Yes.
Amazing.
If you want to have gray hair, we can choose directly the gray hair.
No.
Or the opposite. If you tell me that you don't like it, then
Yeah.
we will not choose them, and we can extract only the black group.
Cool, yeah.
The thing about the coloration of the hair, it becomes difficult as we're doing the proper spacing for FUE to truly select out a specific color. It's better to get the right healing in the donor area than to just select out for the darker hair or the grayer hair. And also, once it's transplanted, it can still change, it can change to gray, right? So something to consider. So we usually don't select for a specific hair color. And for some people, there could be a little bit of a mismatch between the donor and the recipient zones, and that's just something they need to accept. And some people eventually end up coloring their hair, but most people end up fine with some slight coloration differences.
I will not recommend lowering the line.
Yeah, I agree with that, doctor. He's clearly has a lot of experience, because he also said, not to lower centrally. So I think that makes a lot of sense. And if they were to measure the proportions for Ali in terms of the horizontal thirds, I think they would find that they're pretty much similar from what I can tell in terms of his upper third, middle third, lower third. And also we want to look at the movement of the frontalis muscle, make sure we're not below the highest point of that frontalis muscle. You can ask people to raise their eyebrows and see where those lines and where the muscle specifically ends. That is also another good point for hairline design. And we have a video dedicated to how at least I look at hairlines and how I decide how to surgically create a hairline. So make sure to check out that video.
If we can only cover the sides, the temporal areas, will be also enough. But if you want to lower it, then we have to know the face proportion. If it's possible to lower it, then we can discuss.
At this point, I already felt a lot better about my choice in this clinic, as it was obvious that this doctor wanted to be as conservative as possible.
The ruler that he's using seems like a more firm type of ruler. Sometimes like a more of a measuring tape is another option, because then you can capture the curvature of the areas. Because when it's just a straighter stretch of, let's say, the scalp or the forehead, for example, then a ruler like this, I think, is fine. But when you have a curved surface, a more flexible type of ruler or tape measure, I think also makes a lot of sense.
Rather than use a lot of hair grafts to make the surgery cost even more. And before you ask, yes, I paid for the surgery out of my own pocket.
As a proportion, we can lower a little bit.
Okay.
So let's discuss it.
Yeah, and it's the same thing for the hairline work that I do, where like I'm thinking more about the aesthetics rather than how much money I'll be making. And most of hairline work is just covered within our, base price that I think is very fair for the quality of work that we do. And it's better to focus on design and what the person actually needs rather than trying to, maximize the number of grafts we use for profit. I mean, I agree with Ali on this one, and it seems like his doctor has the same mentality, which I love.
After an hour of a thorough consultation, I had two options. One is to take the doctor's recommendation by not lowering my hairline to save some hairs for the future should I need them. And two is to slightly go more aggressive and to end up with a better hairline.
A lower does not equal better. Let's make that clear, right? So, and also as we age, it's normal for the hairline to appear higher. That's what happens as people age. So what looks good when you're in your, say, 30s or 40s may not make as much sense when you're in your 60s and 70s. And you want to be normal, natural looking at that age as well. So it's something to consider that lower is really not always better. Plus, where you place the hairline is not necessarily where the hairline appears. And what I mean by that is that most of the time people are not slicking their hair all the way back. Some people prefer that hairstyle, but most people have their hair kind of flowing, and you can easily make the hairline appear even lower with the way that you style your hair, right? Even if it's starting a little higher, with the right style, with a certain hairstyle, you can make it look like it's, centimeters lower than it actually is. So something to keep in mind.
We can lower it, but I'm not sure it is necessary or not, because it looks also, in my opinion, very enough and very natural.
At this point, I was shitting myself, as I was potentially about to make the biggest decision in my life. And so I naturally wanted to procrastinate.
Let this be the biggest decision that Ali ever has to make.
And to delay that decision by heading to a local massage shop to blow off some steam. And let me just tell you now, that turned out to be one of the strangest experiences in my life.
Why do I feel like I've seen this guy on TikTok? That's some crazy ASMR right there.
No problem. No problem.
I hope they irrigate his eyes after this. What is happening? I really hope this wasn't right after the surgeon made his markings, because those markings might not be there after this zhuzh that Ali just got.
And if you thought that this massage could not get any weirder, just wait until you see what happens next.
This is some creepy stuff. Next time someone asks me if they should go to Turkey for a hair transplant, I might have to show them this clip. What is that? Talc? What is that? He is going to be squeaky clean though. We usually ask our patients to use HibaCleanse the night before or the morning of, but this guy, we should start sending our patients to him. I mean, this is next level cleanliness.
Having gotten beaten with an inch of my life,
I don't think I'd want to be the client that follows Ali in this chair, because that must be a big cleanup.
it's finally time to leave. Or so I thought.
No problem. There's more.
No finish.
Soda? Oh, jeez. A little bit for you, a little bit for me. I wonder if this guy's part of the hair transplant team. We'll have to see. Maybe he'll make a cameo there too. Is it the Jackie Chan of Turkey?
As I continued this strange massage, it finally knocked some sense into me to make my decision about my hairline.
Man, yeah, he's gonna have to redo those markings, that's for sure. Oh! Yeah, you see that's a little bit dangerous there. Just my 2 cents. You know, you got the vestibular artery there. Don't want a arterial dissection.
After an hour of a relaxing massage, I headed back to the clinic with my decision in hand. But there was one small issue to take care of.
Oh,
All right, so he's going the full head shave route. You know, sometimes we do just a donor shave. Other times we do full head. Sometimes you can do recipient area and the donor area get shaved down, but the rest of the hair is left. It just depends for hairline work in particular. Sometimes if it's just more finesse hairline work, we just trim down the area that's been marked out. And other times we can work around the long hair, depending on the scenario. And sometimes we even do a no shave for the donor area if it's a smaller procedure. And if that's an important consideration for the patient.
wow. Okay. Yeah, let's get going. Oh, God.
You got to start in the middle because there's no going back after that. So we can see the markings here, and what they've marked out is just for the frontotemporal corners, and it looks like he's not dropping the central hairline, which I think was a good move. And in just those corners, most likely they'll be able to fit anywhere between, let's say, 400 and maybe 800 grafts per side, right? So I think his total case size will probably be in the range of maybe anywhere between 1,000 and maybe 1,600 or 1,800 grafts. I don't think they'll be able to squeeze in much more than that safely, and I think that should be an adequate number to give him the boost that he's looking for in those areas, but we'll see what happens.
Oh my God. I've never seen myself like that before. So the doctor gave me an option of keeping the hair and doing the hair transplant around it, or shaving it and starting again from zero. I opted out for the zero.
With me looking like a potato, it was finally time to make that decision.
I recommend you the option which is on a little higher,
Yeah,
because needs less number of graft. You are not using medication. It is safe for the future. That's why.
You see, he mentioned that Ali is not on medication, and what he mainly means by that is the use of finasteride to prevent further hair loss. I think that the vast majority of people who get hair transplants ought to also be on finasteride, men in particular, because you just never know what will happen with your hair over time. And the design here won't make much sense if the hair continues to recede and thin out. So being on finasteride is like a belt and suspenders approach, which I think is the better, more logical approach for long-term hair stability and for the transplant to actually make sense down the road, right? And again, that's where finasteride comes in, and it's just a really important part of hair restoration, and that works synergistically with the hair transplant. And minoxidil is more for thickening, so for patients with some diffuse kind of thinning patterns, or let's say the crown's a little thin, minoxidil can be really helpful. For a person like this, in Ali's case, it doesn't seem to me like minoxidil makes any sense to add to his regimen, but finasteride would be very important.
My responsibility is showing you options,
Yeah.
every option with their advantages and disadvantages.
Yeah.
This lower hairline has only advantage, looks for you a little better,
Yeah.
but has some possible medical disadvantage in the future.
What do the ladies think?
Let's
I
ask.
think they both look fine.
They both look good? You're very
Actually,
Not a big difference.
I think I only got like a few years of enjoying my hair anyway. So let's go aggressive. Let's do it.
Okay, the lower.
I don't think that's the best mentality when it comes to hair because, again, the DHT resistant hair that's placed, that's usually what we're placing with a hair transplant, that hair will be more resistant to falling out, right? And so you don't want a situation where you have mostly transplanted hair, the banana, some of my patients call it, and then you have this further recession and then there's a separation and it doesn't look as natural. Then you're chasing it with more and more grafts and eventually you kind of run out of supply, right? So in order for that not to happen, I think it's important to think about not just enjoying your hair for a couple of years, but really how things will look in years to come.
Yeah, let's go for that.
You smile better. With this,
Let's do it.
At this point, there was no going back, and it was time for me to get my new hairline. Wish me luck.
Here we go.
So it looks like they're starting with the harvest here, and that's definitely how some people do this. You do the harvest, then you use either implanters or pre-made sites and then place into those, right? So that is a fine way to do this surgery. My preference for these smaller areas is to actually start with the site making. So we always do a small sample harvest so we can figure out the caliber of the hair, and then I actually move on to making sites. Those are the homes for the grafts, so that by the time my sites are made, I know exactly what we need to harvest. It's less guesswork, and I think it's more precise, but other people do it this way where they sort of guesstimate how many grafts they'll need and then they do the work in the front. Both are very reasonable ways of doing the surgery, but I've personally switched over mostly for especially hairline to doing sites first, then the harvest, then the implantation.
Right away, I was feeling very nervous. After all, this was going to be the biggest procedure that I've ever done in my life. However, after just 5 minutes of having my hairs extracted, I realized that I was under the supervision of one of the best doctors in the world.
There are two main parts of the surgery.
So it's interesting, he had that one surgeon who initially did the intake and the planning, and then it seems like he maybe passed them on to another surgeon who's now responsible for his procedure. I know Ali mentioned, kind of like knowing exactly who you're selecting, and in this case, I don't know if he knew he was going to be in this other person's care or not, but again, point being that this is teamwork, a team effort. You have to choose your head surgeon and trust that they have a plan for you to take the best care of you possible. But I think in terms of the exact structure of the day and who the team members are, I think it's very fair for patients to ask for a general outline of how things are conducted in their clinic.
One is the extraction, the other one is the implantation. We make manual extraction plus stick and place implantation. We like manual extraction because you can feel the grafts. The manual extraction is better than the motorized, but that's disadvantage.
See, this is interesting. So they're not using any motorized systems. They're just going in with this, metallic tool and just basically twisting around each of the grafts to basically wiggle them out. And that is how FUE surgery was done for many years. Nowadays, most hair transplant clinics have moved on to more motorized forms of harvest where you have a handpiece and it's powered and you have a pedal, for example, and you press on the pedal and there's either a sharp rotary type of mechanism or what I use, which is the WA system by DeVroy, which is an oscillating system, so that by the time you get down to the actual bulb of the follicle, there is less trauma on that bulb. It's just like if you're getting like a cast removed, right? And there's that kind of saw-like oscillation that by the time it touches your skin, you really don't get cut, right? It just cuts through the cast. It's a similar type of technology for harvesting. So I'm surprised, that they're still using the kind of the manual method, but I think it's a very valid way to do the extraction. It's a little bit more onerous on the person extracting because, you're constantly using your wrist to kind of twist And, that can create some difficulties over time in the person's wrist and such. But I think it's very valid. It works. It's been shown to work for many years. So that's fine. But like I said, majority of people doing like high-level hair transplant surgery have converted over to more motorized systems. So it's interesting, though, to see, people have different ways of achieving good results.
But that's disadvantage. You can take little amounts. At the same time, with the motor can take big amounts of graft.
Right, so it's a slower movement, and that repetition on the operator's wrist can be troublesome over time. Again, that maybe doesn't affect the patient, but from a surgeon's perspective, you want to have good longevity in this field, and so you have to consider all the ergonomics and the impact on our body doing this day in and day out.
Graft per day, but we believe that we can achieve good results with this method. That's why for 15 years we are using this method.
In hair surgery, people get almost like zealous and spiritual about the type of way that they do different elements of surgery, right? So it's hard for them to switch to something new. And I'm just like that as well, because, you get used to something and you're like, well, this is working in my hands. Like, why am I going to switch to something new? I don't know if that's going to work as well in my hands. So that's just something to keep in mind, because hair takes so long, right, to fully grow out and for you to really see the final results. So it's scary to be doing surgery for months and, potentially not getting great results, only to realize that, it's because you switched over to this new technique or this new tool or something new in your anesthesia mix, right? So a lot of us just kind of, whatever is working, we just keep doing it. But there are times when it is worth switching to something newer, something a little better.
So I've been in the surgery room for almost an hour and a half, and we've extracted most of the hair from the back of my head. So when they put the anesthesia in, I guess that was the only kind of painful part. Obviously, you feel the long needles coming in. But after that, honestly, I felt nothing. Everything was completely numb. And I was so relaxed that I even ended up falling asleep.
Nice, yeah. And I wonder if they gave him any sedatives. We usually give Ambien and Valium to calm the nerves. That helps people. But yeah, the amount of pain out of the course of the full day is just on the order of minutes from the shots. So it's pretty minimal if done right. So it seems like it wasn't too bad for him, which is great.
That even woke up. Sorry, I know I am mumbling. My eyes are probably puffy and the camera is even blurry. I can't really see it that well, I guess, from all the anesthesia kicking in. But I guess the next step is we will go ahead and use those extracted hairs that they have back in surgery, and then we're going to go ahead and use them to put at the front of my head. Here we go. This is the second part.
So we'll see here which methodology they'll use for actually placing the grafts. Will they make pre-made sites? Will they use sharp implanters? Let's see.
As soon as the hair implantation began, I felt a lot less nervous, as I was reassured to see that the surgeon was doing the entire procedure to give me the maximum natural result.
So they did mention stick in place earlier, and from what I can tell, I think the surgeon is there on the patient's right-hand side, and he's, I think, making sites. Again, it's blurred out, so I can't fully see, but that's my guess. And then his assistant on the patient's left is placing grafts into those sites. So I think that's what they're doing here, called the stick in place method. I like to actually create most of my sites early in the day. Again, like I said earlier, that helps me figure out how many grafts do I actually need when I go to harvest. I think that's a good way to do it. And then later in the day, once the team has placed grafts into all the sites that I made earlier, then we come back with this more stick in place method to go in between those grafts that we already placed and to fine tune it even more so that we can really get a beautiful result. That's the way I prefer to do it these days. Maybe they'll change one day, but at least for now, that's how we're getting our great results.
Extraction anesthesia until putting the last graft. All this time period, a surgeon is on the operation with the sterilized gloves and We make all the surgeries. None of them is made by an assistant.
Based on what he's saying, I'm not sure what to make of it, because that person who is talking, maybe that's him. It doesn't look exactly like that's one of the two people here. I don't know. Maybe these two people are additional surgeons. Maybe they're not assistants. So maybe they just have a team of doctors only, which is cool. But, team dynamics, it's a complex thing. And you need to trust your surgeon that they've really optimized that for, their clinic. And, as long as they're doing it day in and day out in the same way and getting very consistent, reproducible results that, are performed in a safe way, then you should be good.
I then spent another 6 hours in the surgery room until it was the end of my first session.
Will I take it?
Thank you.
Welcome.
Oh, first session. So I don't know. Do they have them coming back for a day 2? We'll see.
Surgeon and a cameraman as well.
Of course, we do all the jobs.
Is there anything you can't do?
This is one way to do it with bandaging of the whole recipient area. We prefer not to bandage at all. We just kind of leave things open. I think with the bandage, in my opinion, you're at high risk for potentially rubbing it on something and then maybe having a graft dislodge underneath that bandage. But there's lots of ways to, have patients leave the office with some sort of head covering versus just open to air.
I feel like I'm a Christmas gift. A beer wrapped.
And by now, I really needed to go to the hotel for some much needed rest.
Because eventually you need to remove this bandage. And in removing it, you run the risk of potentially disrupting grafts, right? So anyway, there's pros and cons. I understand people, sometimes want it covered. We'll use a surgical cap if that's the case, if they want us to cover it with something. But something that's not actually sitting, on the grafts. That's my preference.
So if you've watched my videos previously and you thought that I have no shame, I think now you know that I really have no shame. Look at me. I'm looking like a head. I'm walking outside in a busy traffic.
See, to me, this is more conspicuous than if he just had his grafts visible, but to each his own.
I think a lot of us are probably way too insecure about our weight, about our height, and our hairline. So I don't know, there's probably a life lesson in there for you. Don't give up. Anyway, I'm searching for some food.
Says a guy who just had a hair transplant. We're all insecure about something. That's just human nature.
And I have to stay asleep pretty much on like a, I don't know, what do you call this, 35-degree angle?
Yeah, that's a good angle. 30 to 45 degrees, that's solid.
Maybe even 40-degree. So it might be a little bit uncomfortable.
It's good to also surround yourself with some throw pillows just to limit the chance of you actually rolling over. That's one other, piece of advice that I have for the first few nights after surgery. Some people also choose to sleep in a recliner. That's another good way to do it. We have a video on post-op care after hair transplant if you're interested in that.
But that should help a lot with the swelling.
And after a fairly restful night, it was time to go back to the surgery room to make some further adjustments to make my hairline as natural as possible.
So this is what I'm looking like after the first day. Unfortunately, I am looking like a swollen mushroom.
I'm confused here. So they did 1 day of surgery for those areas at the hairline, and they're bringing him back for some fine tuning. That's not the most common way to do it, but let me see what exactly they're doing this following day. The problem with doing 2-day surgeries, in my opinion, is that the second day people are very sensitive, that the skin is much more sensitive to like the injections and just the swelling. People are already, they've had a long day, so to bring them back for another long day, it's not my preference. And usually for these more discrete areas like the hairline, we can get it done in one long day where we don't have to bring them back for another. But, there's different ways of doing this stuff. So let's see what they have planned for Ali here.
But the hairline is actually looking pretty good.
Also, if you're looking to make adjustments to the hairline the day after surgery, there's already swelling. So as far as like artistic design and planning, it's very hard to do that when there is swelling already present, right? It's hard to adjust visually to that swelling to then redraw the hairline. So I'm still confused at this stage, but let's see what they do.
So there's a lot of blood, but on this side, it looks really nice and clear, nice and straight. Same on this side, slightly higher on this side, so we're gonna go ahead and add some more grafts just to bring it forward as well.
I'm not sure that this was planned. I think potentially he noticed some asymmetry and called the clinic, and maybe they then brought him back for this. This is not necessarily the most common way to do it, but if he had some concerns, maybe they were looking to address it. I will caution this type of approach because of the swelling. The swelling can be asymmetrical, and also the swelling will usually make the hairline look higher than it is in reality, and that's even true at the end of surgery. So seeing some asymmetries develop even towards the end of the day, seeing some swelling, the day after, and seeing some of those asymmetries, it's not the best time to correct a hairline. I think it's usually best to have a really solid marking of the hairline and to have the patient agree, and to everyone in the room to look at it a million times agree, and then to follow those markings carefully with surgery, right? So to really nail down where I see the blue is where I'm going with my sites and my grafts. It's not like I'm going a little bit far off. And then people ask me, why do you make dots, right, at the hairline? It's because for visibility. So I don't have just a centimeter of a thick blue line. And then it's well, am I putting the hairline at the top of the blue line or at the bottom of the blue line or in the middle? It becomes less obvious, right? So having these little fine dots to me is more precise and accurate, but everyone again has a different approach. But again, I would just be very careful with dropping hairlines on one side to correct asymmetry the day after surgery. Everyone does things differently in this field.
Overall though, I am looking really, really happy. I'm starting to look like Andrew Tate.
And I was joking earlier about when he went to the guy who was doing his massage and hair treatment, that he seemed to have gone to him after the markings were in place. And obviously with all of that shampooing and all that, it could have removed some of the markings, but it did seem like they redid the markings before they started surgery. So it should have corrected any markings that were washed out by that treatment. But that's, another risk of going for that type of grooming on the day of your surgery.
In the implantation method, you must follow two important angles and directions. In the front area, in the frontest line, it must be 15 degrees or less.
Not necessarily. It depends on how it is for that individual. It's very much customized, right? So some people's angulation of their hair is closer to 90 degrees. Other people closer to 30 degrees or 45 degrees. The key is actually to observe what's there and to recreate that. And again, we talk about that in the hairline design video, so make sure to check that out. But this is where the customization comes in hair transplant surgery and the artistry. And when people ask me, what do you do that's different from other people? I just take the time to follow what's there naturally for that specific individual and recreate it, and recreate it in a way that looks as naturally as humanly possible. And that takes experience, but it just takes time and patience. But, these general rules of 15 degrees and 30 degrees, no, I would argue it just depends on what the person has naturally, and that's what they need more of.
For natural vision, the higher angles will be unnatural and so noticeable. For the top and the vertex, it can go up to the 30 degrees, but less is better. The second one is the direction of the hairs. If there's an existing hair, you must follow the existing hair's direction.
Yeah, but you got to follow its direction and its angulation.
For natural and good result.
And after another night of sleep, it was finally time for me to see my new hairline.
Remember, hair is art, so don't forget that. It's not just about moving grafts around.
Wish me luck.
I feel like a plant. So I'm going to go ahead and do the final reveal of my hairline. I haven't seen it yet. I'll keep my eyes closed. You tell me when. Ready?
I'm ready. Are you ready?
I don't know.
Again, it's not much of a final reveal because it's swollen and it's all still, bloody and crusty, and it's going to take time for him to see the final reveal.
No, let's see. All right, here's the mirror.
Oh,
no way. I've never seen my hairline like that. I've always seen it here. Looks amazing. I'm so happy with it.
I'm happy with you. We like.
From what I can see, they introduce some nice irregularity into the hairline, which is great, to see. It's important for the first few rows to be single hair grafts, which I'm sure they did. It's hard to tell, but it seems like, overall they know what they're doing there, which is great. It seems like he's happy, which is, really the ultimate goal of all this.
We like it.
I just need you to fix the rest of my face now. I'm happy with it. I keep catching myself. I'm like, who's this guy? Where's his bad hairline?
When I see patients waving their arms and their hands past their head after hair transplant surgery, it always makes me nervous. I'm always like, no, don't do that to my patients. And they're like, oh, I wasn't going to touch it. But when you're numb, you may not even feel it when you touch it. And then you could, disrupt the graft. So always better to keep the arms and hands down, especially for the first few days after surgery.
Thank you so much, Doctor.
You're welcome. Nice to meet you.
Yeah, appreciate it.
Thank you
So much, Nat.
You're welcome.
So I'm back in the bathroom that I've been doing all these diaries in, and I get to look at myself here. And honestly, guys, I couldn't be happier with what it looks like. I mean, obviously, I look a little bit swollen, a little bit red, and so on. But in terms of hairline, it is literally what I've been dreaming of.
So interesting. So at this stage, they've left them with no covering for the scalp. So maybe that's just the way they do it. They bring people back the following day and they do little tweaks if needed. But again, it's hard to do it when there's a lot of swelling in the area. So that's the only question in my mind. But it seems like they took great care of him and he's happy. And so that's awesome.
It's like it has those irregularities that will make it look natural. If you can see, this is where my old hairline was, and here as well.
So they did reinforce quite a bit right there centrally. So I don't know how many grafts this ended up being. They didn't really say, but if I had to guess, probably closer to 2,000 grafts. I mean, to do the work they did centrally and then out into the frontotemporal regions. But overall, I think they've done nice work from what I can tell.
And he's brought it all the way forward, but it still looks very, very natural. So hopefully when my hair grows.
But again, they have to really, I think, encourage him to be on finasteride, because now his hairline is lower and he has that dense banana, as some of my patients call it. And what if you start to lose hair behind it? It will start to make a little less sense and it might start to look less natural. So getting on finasteride, really key.
I guess in like the next 3 to 6 months, it will look a lot better. And then hopefully I can start doing some short hairstyles. Wow. I didn't think I would have that type of reaction. Like, honestly, I wasn't that bothered with my hair. 60% of the time, or probably closer to 99% of the time, I'm wearing a hat. The rest of it, I'm wearing like 5 kilos of gel. But that is just gonna open a whole load of new opportunities, man. I am so freaking happy. I am over the moon. This is so cool.
Thanks to Ali for sharing his journey. It's always nice when people are so open about their experiences, and it's never easy to be, so revealing and open, and we do appreciate that. So thanks a lot. And also thank you to his clinic for taking such good care of Ali.